I will be performing an IO for vascular access. The supplies I'll be using to perform the Easy IO are gloves, an Easy IO stabilizer, the Easy IO drill along with the needle, alcohol prep pads, hand sanitizer, a syringe, extension tubing, an IV bag and IV tubing, and a sharps container. So the first step to performing an Easy IO is to identify the indication for the use of the IO, which could be cardiac arrest. Next, I'm going to choose the insertion spot, which is approximately 2 centimeters below the knee or the flat aspect of the bone. I'm going to check for any contraindications, which there isn't any. And then I'm going to put hand sanitizer. With my gloves on, I am going to make sure the patient's leg is extended, and I'm going to palpate the insertion site. I'm going to choose my needle based off my patient's height and weight, which is my blue one, and I'm going to prepare my supplies. So I'm going to open up the needle first. I'm going to check if it's expired, which it is not. I'm going to open up my needle and take my drill and connect it. It magnetically connects and place it down, leaving my safety tip on. I am going to open up my stabilizer so it's ready for me to use right away. I'm going to take my syringe and connect it to my extension tubing, and I'm going to begin to clean the patient's insertion spot. So I'm going to take my alcohol prep pad and clean the area where I'm going to be inserting the needle. Next, I'm going to remove the safety tip, put it down. I'm going to take my drill and at about a 90-degree angle, drill into the patient's leg until I feel it give. Next, I'm going to remove my drill and remove the stylet and place into my sharps container. I'm going to take my stabilizer, place it onto the patient's leg, removing the tabs so it's adhesive is touching the patient's leg. Pushing down. I'm going to connect my extension tubing. I'm going to aspirate to ensure I'm getting bone marrow or blood into my syringe. And I'm going to remove my extension tubing, remove the syringe, and throw away into my biohazard and sharps container. I'm going to take my IV tubing, remove the tip, and connect it to my extension tubing. Next, I'm going to flush my extension tubing into just a package. Make sure liquid comes out. And I'm going to next reconnect it to the bone. And I'm going to begin the IV into the patient's leg. I'm going to check for any complications. There's none. I'm going to collect all my trash and throw it away. And then I'm going to remove my gloves. Throw it away as well. I'm going to take a piece of tape, document the date and time, which is 14/30, 11/28. I'm going to take my tape it to the patient's leg along with the tubing. My last step is to use hand sanitizer one more time.